What if I told you that one simple fruit, eaten just 30 minutes before bed, could help protect your eyes from the most common cause of vision loss after age 60? And no, it's not carrots. It's not oranges. It's a small, fuzzy fruit that most people walk right past in the grocery store without a second thought. But here's what makes this truly remarkable. Not only does this fruit contain two of the most powerful nutrients your aging eyes desperately need, it also helps you fall asleep faster and sleep more deeply. And that matters, because new research shows that poor sleep actually accelerates vision damage in seniors. A doctor we consulted called this fruit a two-in-one miracle for aging eyes. Stay with me for the next few minutes because what you're about to learn could genuinely change the way you see the world, literally. Welcome back to the channel. If you're new here, we focus on practical, science-backed health information specifically for adults over 60 and those caring for elderly loved ones. And today, we're talking about something that affects nearly every single person as they age: their eyesight. Let me ask you something. Have you noticed that reading the newspaper has gotten a little harder lately? Maybe you've started holding your phone farther away from your face. Perhaps driving at night has become uncomfortable because oncoming headlights seem brighter and more blinding than they used to. Or maybe, and this one hits close to home for a lot of people, you've noticed a slight cloudiness or haziness in your vision that wasn't there a few years ago. If any of that sounds familiar, you are not alone. According to the National Eye Institute, more than 37 million Americans over the age of 40 have some form of age-related eye condition. And after 60, that number skyrockets. We're talking about conditions like age-related macular degeneration, cataracts, glaucoma, and dry eye syndrome. These aren't just inconveniences. For millions of seniors, declining vision means losing independence. It means not being able to drive safely, not being able to read letters from grandchildren, not being able to enjoy a sunset the way you once did. And here's what breaks my heart. So many seniors accept vision loss as something inevitable, something they just have to live with. But the truth is, while some changes in vision are natural as we age, there is so much you can do right now, tonight, to slow down that process, protect the vision you still have, and in some cases, even improve your eyesight. And it starts with something as simple as eating the right fruit before you go to sleep. So let's get into it. Before I reveal this incredible fruit and explain exactly why it works, I need you to understand what's actually happening inside your eyes as you get older. Because once you understand this, the solution will make perfect sense. Think of your eye like a camera. At the very back of your eye, there's a thin layer of tissue called the retina. The retina is like the film inside that camera. It captures light and sends signals to your brain, and your brain turns those signals into the images you see every day. Your loved ones' faces, a beautiful garden, the words on this screen right now. Now, right in the center of your retina, there's a tiny but incredibly important area called the macula. The macula is responsible for your sharp central vision. It's what allows you to read, recognize faces, and see fine details. And here's the problem. As you age, the macula begins to break down. The cells get damaged by something called oxidative stress. Let me explain that simply. Every single day, your eyes are exposed to things that create what scientists call free radicals. These are unstable molecules that damage your cells. Sunlight creates free radicals. Blue light from screens creates them. Even the normal process of your body converting food into energy creates them. When you're young, your body handles these free radicals pretty well. But after 60, your natural defenses weaken. The damage starts to pile up. And that damage hits your eyes particularly hard because your eyes are one of the most metabolically active organs in your entire body. They work constantly. They never truly rest, even when you sleep. This is how age-related macular degeneration begins. The cells in your macula start to deteriorate. Your central vision gets blurry, colors look less vivid, straight lines start to appear wavy, and if it progresses far enough, you can lose your central vision entirely. Then there are cataracts. The lens at the front of your eye, which is normally clear like glass, starts to become cloudy and yellowed. It's like looking through a foggy window. By age 75, More than half of all Americans either have cataracts or have had cataract surgery. And let's not forget about dry eye, which affects roughly 1 in 3 seniors. Your eyes don't produce enough tears, or the tears evaporate too quickly, leaving your eyes feeling gritty, irritated, and uncomfortable. Now, here's where it gets interesting. Your eyes have a natural defense system against all of this damage. Deep inside your macula, there are 2 specific pigments that act like a built-in pair of sunglasses. They filter out harmful blue light, they neutralize free radicals, they protect the delicate cells that give you clear vision. These 2 pigments are called lutein and zeaxanthin, and your body cannot make them on its own. Let me say that again because it's critical. Your body cannot produce lutein and zeaxanthin. The only way to get them is through the food you eat. And as you age, the levels of these protective pigments in your eyes naturally decrease. So you need more of them, not less. But most seniors aren't getting anywhere near enough. This is exactly where our star fruit comes in. The fruit I'm talking about is the kiwi. Yes, the humble kiwi. That small brown fuzzy fruit with the bright green flesh inside. The one you've probably seen sitting quietly in the produce section 1,000 times without ever picking it up. Well, after today, I think that's going to change. Let me explain why doctors and eye health researchers are getting so excited about kiwi fruit, especially for seniors. First, and most importantly, kiwi is one of the richest fruit sources of both lutein and zeaxanthin. Remember those 2 protective pigments I just told you about? The ones your eyes desperately need but your body can't make? A single kiwi fruit contains a significant amount of both. In fact, studies have shown that regular kiwi consumption measurably increases the concentration of these pigments in the macula of the eye. Think about what that means. By eating this one fruit consistently, you're essentially reinforcing your eye's natural shield against damage. You're thickening that protective layer. You're giving your macula the raw materials it needs to defend itself against the oxidative stress that causes age-related vision loss. But that's just the beginning of why kiwi is so special. Kiwi is also extraordinarily rich in vitamin C. In fact, a single kiwi contains more vitamin C than an orange. Most people don't know that. And vitamin C is absolutely essential for eye health. Research published in the British Journal of Ophthalmology found that people with higher vitamin C intake had a significantly lower risk of developing cataracts. Vitamin C helps maintain the health of blood vessels in the eye. It supports the collagen structure that keeps your cornea and lens strong and clear. And it's a powerful antioxidant that fights those damaging free radicals we talked about earlier. Now let me pause here and ask you something. Are you enjoying learning about this? If so, go ahead and hit that like button right now. It's a small thing for you, but it helps us reach more seniors who need this information. And trust me, someone you know could benefit from hearing this today. All right, let me tell you the 3rd reason kiwi is remarkable, and this is the part that really ties the whole before bed routine together. Kiwi has been scientifically proven to improve sleep. A study published in the Asia-Pacific Journal of Clinical Nutrition found that adults who ate 2 kiwi fruits 1 hour before bedtime fell asleep 35% faster, slept more soundly, and experienced significantly better overall sleep quality after just 4 weeks. Why? Because kiwi contains natural serotonin. Serotonin is a brain chemical that helps regulate your sleep-wake cycle. Kiwi also contains folate, and low folate levels have been linked to insomnia. Additionally, kiwi is rich in antioxidants that reduce inflammation in the body, and inflammation is one of the things that disrupts sleep. Now, you might be thinking, okay, better sleep is nice, but what does that have to do with my eyes? The answer is everything. And this is the part that most people, even most doctors, don't talk about enough. Here's something that might surprise you. Your eyes do their most important repair work while you sleep. During deep sleep, your body enters a state of restoration. Blood flow to your eyes increases. Damaged cells in the retina are repaired. The protective pigments in your macula are replenished. Inflammatory chemicals that build up during the day are cleared away. Your tear film, the thin layer of moisture that protects the surface of your eyes, is restored and rebalanced. When you don't sleep well, none of that happens properly. A major study from the National Sleep Foundation found that people who consistently got poor sleep were significantly more likely to develop glaucoma, macular degeneration, and diabetic eye disease. Another study published in the journal Sleep Medicine found that chronic insomnia was associated with a 40% increased risk of developing vision-threatening eye conditions, 40%, just from not sleeping well. And here's the heartbreaking reality for many seniors. Sleep problems are incredibly common after 60. Nearly half of all older adults report difficulty falling asleep or staying asleep. Many turn to over-the-counter sleep medications, which come with their own risks and side effects. Some just lie awake for hours, staring at the ceiling, night after night. So when you eat a kiwi before bed, you're doing something doubly powerful. You're directly delivering protective nutrients to your eyes, and you're improving the quality of your sleep so your eyes can repair themselves more effectively overnight. It's like giving your eyes both the building materials and the construction crew they need, all from one small fruit. If you're over 60, or if you're caring for an elderly loved one, this information could genuinely be life-changing. Please consider sharing this video with someone you care about. You might be helping protect their vision for years to come. Now, while kiwi is what I consider the single best fruit to eat before bed for eye health, I want to give you a few more options that you can rotate into your evening routine. Variety is important, and each of these fruits brings something unique to the table. Number 1, blueberries. Blueberries are sometimes called vision berries, and for good reason. They contain powerful antioxidants called anthocyanins, which give them their deep blue-purple color. Anthocyanins have been shown to improve night vision, support blood flow to the retina, and help protect against retinal damage. A study from Tufts University found that blueberry supplementation actually improved visual function in older adults. A small handful of blueberries before bed is a wonderful addition to your eye protection routine. Number 2, tart cherries. Tart cherries are one of the only natural food sources of melatonin, the hormone that regulates sleep. Eating a small serving of tart cherries or drinking tart cherry juice in the evening has been shown in multiple studies to improve sleep duration and quality in older adults. And like kiwi, tart cherries are also loaded with antioxidants that fight inflammation and protect delicate eye tissue. Number 3, red and purple grapes. Grapes, especially the dark-skinned varieties, contain a compound called resveratrol. You may have heard of resveratrol in connection with red wine, but you can get it directly from grapes without the alcohol. Research from Washington University School of Medicine found that resveratrol can help protect the retina from age-related degeneration. Grapes also contain natural melatonin, making them another excellent choice for a before-bed fruit that supports both sleep and vision. Number 4, mangoes. Mangoes are one of nature's richest sources of beta-carotene, which your body converts into vitamin A. Vitamin A is fundamental to eye health. It helps maintain the surface of the eye, supports the function of the retina, and is essential for the ability to see in low light. A vitamin A deficiency, even a mild one, can cause night vision problems and dry eyes. 1 cup of mango provides about a quarter of your daily vitamin A needs. Number 5, papaya. Papaya often gets overlooked, but it's an eye health powerhouse. It's rich in beta-carotene, vitamin C, and vitamin E, all of which are protective antioxidants for the eyes. Papaya also contains an enzyme called papain, which has anti-inflammatory properties. Inflammation plays a major role in nearly every age-related eye condition, so anything you can do to reduce it helps protect your vision. Now, I want to be clear about something. You don't need to eat all of these fruits every single night. That would be a lot of fruit. The idea is to make kiwi your primary go-to, and then rotate these other fruits in throughout the week for variety and additional benefit. The key is consistency. Eating 1 serving of an eye-protective fruit before bed, as part of a regular nightly routine, is what creates results over time. Let me put this all together into a simple, easy-to-follow evening routine that any senior can start tonight. I call this the Vision Protection Night Routine, and it takes less than 15 minutes. Step 1. Eat your eye health fruit about 30 to 60 minutes before bed. Cut up 1 or 2 kiwi fruits. Eat them slowly. Enjoy them. If you don't have kiwi, reach for blueberries, tart cherries, or any of the other fruits we discussed. Some people like to make a small fruit bowl with kiwi slices and a handful of blueberries. That's a beautiful combination for your eyes. A quick tip about kiwi. You can actually eat the skin. I know that sounds strange, but the skin of a kiwi is completely edible and actually contains a concentrated amount of fiber, vitamin C, and antioxidants. If you don't like the fuzzy texture, try golden kiwi, which has a smoother, thinner skin and a slightly sweeter taste. But if eating the skin bothers you, that's perfectly fine. Just scoop out the green flesh with a spoon. Step 2. Take a break from screens at least 30 minutes before bed. This is critically important for your eye health, and almost nobody does it. The blue light emitted by your phone, tablet, computer, and television causes direct stress to your retina. At night, when your eyes are already tired from a full day of use, this stress is even more damaging. Blue light also suppresses melatonin production, making it harder to fall asleep, which means your eyes miss out on that essential overnight repair time. I understand that many people like to watch television before bed or scroll through their phone. If you absolutely must use a screen in the evening, at least turn on the blue light filter. Most phones and tablets have a setting called night mode or night shift that reduces blue light. But ideally, give your eyes a complete rest from screens in that last half hour before sleep. Step 3. Apply a warm compress to your eyes for 5 to 10 minutes. This one surprises a lot of people, but it's recommended by ophthalmologists for good reason. A warm compress, which is simply a clean washcloth soaked in comfortably warm water and placed over your closed eyes, does several wonderful things. It stimulates the oil glands in your eyelids, which improves tear quality and helps with dry eye. It relaxes the muscles around your eyes, reducing strain and tension. It increases blood circulation to the eye area, and it feels incredibly soothing and relaxing, which helps you wind down for sleep. You can use a warm, damp washcloth, or you can purchase a microwavable eye mask designed for this purpose. They're inexpensive and widely available. Just make sure the temperature is comfortable, not too hot. Warm, not burning. Step 4. Sleep in a properly darkened room. Your eyes need true darkness to fully rest and repair. Even small amounts of light filtering into your bedroom can disrupt your sleep quality and interfere with melatonin production. Use blackout curtains if you can. Remove or cover any electronic devices with glowing lights. If you use a nightlight for safety, choose one with a red or amber glow rather than blue or white, as red and amber light has the least impact on melatonin production. Step 5. Stay hydrated, but be smart about it. Dehydration is a major contributor to dry eyes, especially in seniors who may not feel thirsty as readily as they used to. Make sure you're drinking adequate water throughout the day. However, try to do most of your drinking earlier in the day and taper off in the evening so you're not waking up multiple times during the night to use the bathroom, which disrupts your sleep. A small glass of water with your evening fruit is perfectly fine. Just don't drink a large amount right before lying down. That's the routine. Fruit, screen break, warm compress, dark room, proper hydration. 5 simple steps, 15 minutes or less. And the cumulative effect on your eye health over weeks and months can be truly significant. Now, while this routine is powerful for prevention and protection, I also want to make sure you know the warning signs that mean you should see an eye doctor right away. Many seniors ignore these signs, either because they think it's just normal aging or because they're afraid of what they might hear. But catching eye problems early is absolutely critical. Early treatment can often save your vision. Delayed treatment sometimes cannot. Please see an eye doctor as soon as possible if you experience any of the following. Sudden blurry vision in one or both eyes. If your vision suddenly becomes blurry or hazy without explanation, this could indicate a serious problem like a retinal detachment or a sudden change in blood flow to the eye. Flashes of light or a sudden increase in floaters. Floaters are those small spots or squiggly lines that drift across your vision. Having a few is normal. But if you suddenly see a shower of new floaters, especially accompanied by flashes of light, this could be a sign of retinal detachment, which is a medical emergency, a dark shadow or curtain moving across your vision. This is another classic symptom of retinal detachment and requires immediate medical attention. Do not wait. Go to an emergency room if your eye doctor isn't available. Gradual loss of peripheral vision. If you notice that your side vision is narrowing, like you're looking through a tunnel, this could be a sign of glaucoma. Glaucoma is often called the silent thief of sight because it causes no pain and progresses so slowly that many people don't notice until significant damage has been done. Persistent eye pain, redness, or pressure. Occasional mild irritation is common, but persistent or severe eye pain, deep redness, or a feeling of pressure inside the eye should always be evaluated by a professional. Difficulty seeing at night. If driving at night has become noticeably more difficult, if oncoming headlights cause significant glare, or if you have trouble adjusting when moving from a well-lit area to a darker one, these can be signs of cataracts or other conditions that your doctor can address. Distortion of straight lines. If door frames, telephone poles, or the lines on a page of text appear wavy, bent, or distorted, this is a hallmark symptom of macular degeneration and should be checked immediately. I recommend that every adult over 60 have a comprehensive dilated eye exam at least once a year, even if you think your vision is fine. Many serious eye conditions have no symptoms in their early stages. The only way to catch them is through a professional examination. Before I wrap up, I want to share a few more lifestyle tips that work hand in hand with your new night routine to protect your vision long term. Wear sunglasses whenever you're outside during the day. Ultraviolet light from the sun is one of the biggest contributors to cataracts and macular degeneration. Make sure your sunglasses block 100% of both UVA and UVB rays. You don't need expensive designer sunglasses. Even affordable pairs offer full UV protection as long as the label says so. Eat more leafy green vegetables. Spinach, kale, collard greens, and Swiss chard are all excellent sources of lutein and zeaxanthin, those same protective pigments we've been discussing. When you combine these vegetables during the day with kiwi fruit at night, you're giving your eyes round-the-clock protection. If you smoke, please consider quitting. Smoking doubles your risk of macular degeneration and significantly increases your risk of cataracts. It damages blood vessels throughout your body, including the tiny, delicate vessels in your eyes. I know quitting is incredibly difficult, but your eyes, your lungs, and your heart will all thank you. Manage chronic conditions like diabetes and high blood pressure. Both of these conditions can cause devastating damage to the blood vessels in your eyes. Diabetic retinopathy and hypertensive retinopathy are leading causes of vision loss in older adults. Keep your blood sugar and blood pressure well controlled through diet, exercise, and medication as prescribed by your doctor. Give your eyes regular breaks during the day. If you read, watch television, or use a computer for extended periods, follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for at least 20 seconds. This simple habit reduces eye strain and gives your focusing muscles a chance to relax. Let's bring everything together. Your eyes are one of the most precious gifts you have. They connect you to the people you love, the beauty around you, and the independence that matters so much as you get older. And while some changes in vision are a natural part of aging, you have far more power to protect your eyesight than you might think. Tonight, before you go to bed, I want you to try something simple. Go to the store and pick up a few kiwi fruits. Cut one open, eat it slowly. Let those powerful nutrients, the lutein, the zeaxanthin, the vitamin C, the natural serotonin, go to work for your body. Put away your phone. Place a warm compress over your tired eyes. Turn out the lights. And sleep deeply, knowing that while you rest, your eyes are healing and rebuilding their defenses. Do this tonight. Do it tomorrow night. Make it a habit, because it's the small, consistent choices that add up to something extraordinary over time. You don't need expensive supplements. You don't need complicated treatments. You just need one small, fuzzy fruit, a few minutes of care, and the commitment to show up for your health every single day. Your eyes have spent a lifetime showing you the world. Now it's time to take care of them in return. If this video helped you, I want to ask you for 3 small favors. First, please hit that subscribe button and tap the bell so you never miss a new video. We post senior health content every single week, and there is so much more valuable information coming your way. Second, share this video with someone you care about, a spouse, a sibling, a friend, a parent. If they're over 60, this information could help protect their vision for years to come. Just tap that share button and send it their way. It takes 2 seconds, and it could make a real difference in someone's life. And third, leave me a comment below. Tell me, have you noticed any changes in your vision lately? Have you ever tried kiwi before bed? I read every single comment, and I love hearing from you. Your stories inspire me to keep creating this content. Thank you so much for watching today. Take care of yourselves, take care of your eyes, and I'll see you in the next video.